The holiday season brings goodies and gifts, but it also brings flu viruses and mishaps. UC San Diego emergency medicine doctor Christian Tomaszewski joins me now to talk about how to prevent the flu and why child-proofing your home can go a long way in avoiding ER visits. Dr. Tomaszewski, the flu season has not officially started yet, but ER rooms traditionally are the first to see flu outbreaks. Do you have any predictions for San Diego this year? What kind of season can we expect?
I don't have a crystal ball, but we've started to see a few cases. I mean, California is sporadic on the map, but other states have already gone full force with cases. So it's still early here. We'll probably take off in December, maybe January, February. It's coming.
Okay, well, to make sure that it doesn't come, what sort of precautions can people take to avoid the flu, and who is at most risk from the flu?
The precaution, it's really easy, folks. I mean, get your flu shot. Immunization is most of the battle. You want it by getting immunized. And then the second thing is hand cleansing. I mean, we work in the emergency department. We're exposed to people who are sick all the time, tons of flu cases. And do we end up getting sick and taking it home? No, because we make sure that every room has an alcohol dispenser that we clean our hands when we go in and when we come out.
How busy are emergency rooms during the holidays, and what can you tell people about how best to navigate their way through the ER?
Well, I don't really want to dissuade people from coming to see me, but, you know, on the holidays themselves, usually we don't get a lot of cases. People are putting off things, they're attending to their families or maybe to shopping, and as those activities end, they start thinking about themselves or the illness they put off. And that's when they show up to see us. You know, a lot of doctors' offices aren't closed around the holidays, so we see a big surge in cases the day right after the holidays and for the next few days after that.
Who should not visit the ER? Are there people who you would discourage from doing so?
I don't want to dissuade people to come to see us if they need our help, but if you have a simple viral illness like a cold or even the flu and you're young and healthy, you know, you don't have coexisting illness, there's not a lot we're going to do for you. Take some Acetaminophen, some over-the-counter medication, and wait a couple hours and see if you feel better. If you're getting worse, if you're having chest pain, trouble breathing, you can't keep stuff down, or your loved one's acting funny, yeah, absolutely, come on in. And, I mean, that doesn't really hold. If you're in a high-risk group, then you probably should come if you don't feel well.
And what types of conditions or injuries do you typically see around the holiday season?
Well, think about it. We got a perfect mixture. We're mixing fat, sugar, alcohol, excess calories. So we're bound to see increases in heart disease as fluid builds up in people's lungs and they put off seeing the doctor. Heart attacks have been noted to go up right around the holiday season, right after a few days after the holiday. And then there's always the wannabe Julia child who gets some alcohol and decides they're going to cook something up and they don't know how to handle knives. So we always see occasionally people trying to cut things in their palm. That doesn't turn out so well.
Okay. Around the holiday season, I mean, there's a lot of traveling going on, people visiting relatives with their young kids, and they're visiting people who don't necessarily have young kids, and so their homes may not be child safe. What sorts of injuries are you seeing as a result of this, and what can be done about it?
Well, you're disrupting the normal routine, so you're having little ones come to your house, and you're a senior, you may not be child safe, so they can get into things that you never imagined. For example, we're starting to see problems with these laundry packets or pods. They look pretty, they're multicolored, they're convenient for washing your clothes, but if a child gets in those, just like in the washing machine, they dissolve and they can cause breathing problems, and actually we've had kids lose consciousness and end up on a ventilator.
And so the idea is to keep that stuff stored high and away from children, and so what are you telling people?
Well, do an assessment. You know, if you got little ones coming to your house, is your house child safe? Because you're not used to having kids there. And if you're taking your little ones to a new home, make sure you do just touch base with the host and see if there's any hazards there. And then the other thing I run into is seniors putting their pills out or losing them. Just one cardiac medication, for example, blood pressure medicine, can create havoc in a 10 or 20 pound toddler.
And there's cardiac medication. What about acetaminophen? I mean,
the good news is kids are pretty resilient to acetaminophen. They got to take a lot, and when most child's acetaminophen is packaged, there's a dose there that's not going to cause a problem. They drink the whole thing. The error we see with kids is repeated dosing of high amounts, error. So make sure you check twice. Check twice. You measure twice, cut once. When you give children medication, we've seen errors in overdosing.
Okay, and what about children being vaccinated for the flu? I know that in previous years we've had a shortage of vaccines for the flu. What are you seeing this year?
This year we're doing okay, so take advantage of it. Go get it. I could tell you go get it before we run out, but so far we got good supplies. And that includes pregnant women. The best way to protect your future child is to pass on immunity through them. And you do that by you getting the flu vaccine so that they have the immunobodies, the immune bodies against the flu.
Dr. Tomaszewski, thank you so much for speaking to us today.
Sure. Thanks for having me. Take care.